The hospital, I think, is we've had positive accolades come back from both the hospital administration as well as the ED physicians. So from the hospital administration standpoint, many times they can expect improved subspecialty reads by having this system. So as a hospital administrator, I think what they can view as a positive is that they can be confident that their studies are read by the most appropriate radiologist in a group of 60, as opposed to hoping that one of the 2 or 3 radiologists that happen to be at that location that day can take care of this study. So one of the things that we found in radiology over the last couple of decades, that is, as the technology has advanced and as groups have become larger, radiologists have become more and more subspecialized. And that's advantageous. Certainly that's advantageous to be able to give more accurate reads. However, it becomes somewhat of a challenge for a hospital, a small hospital that maybe only can staff with 2 radiologists as opposed to 8 or 9 radiologists that are at our tertiary care centers. It's difficult for them to be able to expect and demand that those 2 radiologists can take care of all the studies to the level of expertise that a subspecialist could. So by having the system in place, the hospital administrator can be confident that not only are the studies read quickly, because the stats are going to be able to be taken care of when their radiologists are occupied, but I also think that they can be assured of a higher level of accuracy when a large group is involved and they're able to have their temporal bone CT that's done at a community hospital read by a world-class subspecialty trained ENT radiologist. From the standpoint of the clinicians that are working at the hospitals, what this is allowed for is better staffing by the radiologist on site. So as I said, for example, at CCMC we've moved from 2 8-to-5 shifts to an 8-to-5 and a 10-to-7 shift because of the overnight work being able to be taken care of. We also, because of Intelerad, we have one person that is on, at least one person that's on 24/7. We have 3 people on until midnight, 2 people on until 1 a.m. and 1 person from 1 a.m. to 7 a.m. And so as a hospital administrator, you don't have to worry that your study is being sent to Australia, being interpreted by someone else, and that it may not be to the level of expertise that you need. It allows us to have greater coverage, and that many times results in savings for the hospital, depending upon who has to pay for the overnight reads. I think our primary goal was to improve patient care by being able to have all of these studies available. A secondary goal was to improve our workflow. So we would be able to have one person at a certain location be the neurospecialist for the day and be able to read the studies from different locations. So when it was first deployed, I remember remarking how I was sitting in Hartford reading a study from someone from Westfield who had a comparison study from Holyoke. And in one location I was able to review all that information. There have been times where I was consulted by one of the general radiologists who was reading a study at one of the community hospitals. And he came across a pediatric study on a patient that was being transferred to CCMC. I knew that a follow-up study would be necessary, and I knew what the right one was based upon that prior information. So as the patient was being transferred, I could call, and did call, the CCMC emergency room physician to let them know that a patient was being transferred, that I had already reviewed their imaging, and that as soon as the patient came in that I recommended that a follow-up study be done and to notify me when the patient was there. So our primary goal was to improve patient care by being able to put all of our studies under one roof, and kind of secondarily out of that came a better workflow and I think improved productivity amongst the radiologists. The feature that stands out the most, I think, is the creation of an enterprise-wide reading system. So my understanding is that many of the competitors don't offer the ability to scale the product as we add on hospitals, and the ability to put all of these different hospitals with variable and potentially conflicting PAC systems all under one roof. So I think that those are the main features. As well, working with a company that is growing their product, the ability to regularly communicate with the folks at headquarters in Montreal, to be able to make suggestions for improvements, to be able to work collaboratively, and to be able to get very prompt fixes when something goes wrong. I think those are all very strong features of IntelliOne.